I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. I am Dr. Ed Weiner, Chairman, and with me tonight are board members, Vice Chair Gail Demore, Member Mary Beth Welch, Andrea Sheehan, and Mara El Sabahi. Also with us this evening is Susan Luminello, Director of Public Health, Michael Green, Associate Director of Public Health, our Environmental Engineer, Christine Mathis, and our Recording Secretary, Julie Falkingham. Please note that we were live on and will be taped by BCAT and available for appropriate comments and questions throughout this video technology. And as always, thank you for BCAT for what you do for this community, keeping us all aware and so well informed. Our first action this evening is approval of minutes. And we have two sets of minutes tonight to approve. The first is March 26, 2024. Do I have a motion to approve?
So moved.
I have a motion by Mary Beth Welch, second by?
Second.
I guess second. You do so, Mara.
Go.
Second by Andrea Sheehan. Any other discussion, additions, omissions? All in favor?
Aye.
The second set of minutes are April 9th, 2024. Do I have a motion to approve?
So moved.
I have a motion by Gail Demore, second by? Second by Mary Beth Welch. All in favor?
Aye.
Aye. The next is citizens' time. I don't think there's anybody here. And can we access anybody through our video technology this evening?
There's nobody on the WebEx.
There's nobody on. Okay. The next is our chairman's report. I'm happy to report that town meeting approved our 2025 budget last evening. And now this. On behalf of all of the elected board members, I want to thank our professional staff, public health intern, which is Kali Sabag, who just graduated from the University of Lowell, and Medical Reserve Corps members who worked so hard to make our 2024 annual health fair such a wonderful success. We as a board were all there to see almost 60 health organizations, exhibits, providing education and information about the services they can provide for our community. There were vendors, self-help organizations, diagnostic companies, and health agencies, including exhibits by the Burlington Police and Fire Departments, not to mention lots of healthy bananas from Trader Joe's. So many residents thanked us for our outstanding event, and I want to thank Beth Israel Leahy Help for their sponsorship and assistance. I think we can all agree it was just great. This is one of the most important goals of the Burlington Board of Health. It is to promote health and to improve the lives of our people within this town. I'll ask if there's anybody on the board who'd like to make comments about the health fair. You were all there. Anybody else, or did I cover it all?
I thought you covered it all. It was a great event.
It was a great event. Thank you very much. We have subcommittee reports. You have a subcommittee report this evening. Do you want to wait until we discuss Dynacure?
Sure.
Yeah.
Okay. So that brings applications for special permit and minor engineering change, One Rounder Way.
Yeah, that's we should come before that, that's them. Or do you
That's
want,
them.
I mean, we're going to give you an update after they provide an update. I don't know if it makes sense.
Which, whenever you'd like. First, if you could let them present,
Yeah.
and you can give
Okay.
us an update.
Perfect.
Would that be all right?
Sure.
Okay, please. Do we need them to sign in? So we knew who you are.
Dig that one too. I don't need to.
Stereo.
Just name?
Everybody has a copy of the
Yes.
presentation?
Could you give us your names while you're,
Sure. My name's Julia Winyard. I'm the Senior Project Manager with CSL Consulting.
I'm sorry, how do you spell your last name, please?
It's Wynyard.
My name is Ming Zhang. I'm a board member of Dynamic Cure.
I'm sorry, last name, please?
Z like in zebra, HONG.
Thank you. And
Hi, my name is Lauren Harvey, and I am the manager of facility and lab operations at Dynamic Cure,
that's HARVEY.
VEY.
Thank you.
Mr. Chairman, we have 4, I believe, people online that are associated with them. It's Steve, Jingping Lee, John Lee, and Yang Bao Kai.
Now, just one, who will be the scientific individual who I can ask scientific questions to?
Steve will be our primary animal expert, and Jen is our VP of research. Both of them are familiar with animal stuff.
And they are online?
Yes.
Okay. All right, so who's going to present this, our environmental?
I can present. We're just getting some feedback. I don't know if we put.
I can just give you a quick overview.
Give us a quick overview first.
Sure.
Okay, so Dynamic Cure is moving the operations from Waltham to Burlington. They purchased a existing building at One Rounder Way. Their intention is to renovate the 2-story building for use as labs and office spaces. They are doing a complete renovation of the mechanical, electrical, and plumbing for the facility. They're doing some minor modifications to the outside of the facility, some exit and entrance doors, and a new mechanical pad. So they'll be seeking permits from the Board of Health for both a biological safety permit and a hazardous materials storage permit. Well,
We are technologically challenged this evening because they're redoing our room. Now, we are on cable television this evening. However, usually we have a better communication set up here, and we don't have that this evening. So if someone asks a scientific question, it may have to come through one of your support staff.
Yeah, absolutely. That's fine with us. We'll make it work. So just a little bit of background on Dynamic Cure. Christine gave you a great overview. As a company, Dynamic Cure was established in 2019, and they commenced laboratory operations in early 2020. Their team comprises 31 employees worldwide, but 27 of them are located here in Waltham, or in Massachusetts in Waltham. So the vast majority of their employees are Massachusetts-based, and they are predominantly engaged in research and development. In the near term, Dynamic Cure expects that employee headcount to grow to roughly 50 employees also engaged in research and development. So while the company initially concentrated on the development of oncology drugs, they have since broadened their research focus to include autoimmune, neurodegenerative, and metabolic diseases. And in June of 2022, Dynamic Cure advanced to a clinical stage company. They're now overseeing the first investigational drug in phase 1 clinical trials, and they anticipate progressing to phase 2 trials by next year. So as Christine mentioned, they're currently in a leased lab facility in Waltham. So they're at 830 Winter Street in Waltham, and they've been there since the fall of 2020. And that lease expires in early 2026. So in anticipation of that, in 2021, Dynamic Cure's investors acquired the property at One Rounder Way here in Burlington. They selected Burlington because of its reputation for being so friendly to business, and if you're familiar with the site, it's a great location in terms of highway access. It's right near the mall. And they also were keen that it has additional development potential. So the building that's there is 40,000 square feet. It's a 2-story office building. We'll look at floor plans together. But the zoning that was overlaid there actually allows for an addition, almost doubling the building, an additional 35,000 square feet. So as their work progresses, they have the opportunity to really grow this into a major presence. That said, the current applications, the special permit and the minor engineering change are both limited to renovations to the existing building that will facilitate the move from the Waltham location to Burlington, and so that they can be operational by the fall of 2025, because as you can imagine, continuity of the work that they're doing is really important, and they can't afford to have the lab go dark with the work that they're doing. On the next page, you have a description of the project team. So Dynamic Hero owners, we discussed. I'm from CSL. We don't have the rest of the team here, but you probably recognize some of those names. Great team that we've pulled together for this project with a lot of great lab experience and a lot of local experience. If any questions come up that require answers from that team, we can easily follow up with them. And the next slide shows where we are in our application timeline. We submitted for the special permit and the minor engineering change in early March. We've been to the planning board once, which was about a month ago, and we were with your subcommittee last week, and we'll be back with the planning board this Thursday. I should also mention, it's not indicated here, but we did submit with the Conservation Commission for the outdoor mechanical yard, and we will be on with them later this month on the 23rd. Do you want me to pause for questions or keep going through?
Does anyone have?
Okay. So the next slide shows the project location. You're probably familiar with the building. It's visible from the highway. You can see the mall parking lot in the upper left-hand corner of the aerial. And then I would encourage you to skip over the next couple slides. They're pretty impossible to read. Those are just the red lines of the existing surveys. If you go to the third markup, I think that's more helpful. And the changes that are occurring within the building, besides obviously cosmetic, they're really driven by two needs. One, the change in use from office to lab is obviously requires much more intensive HVAC equipment and things like that. So you see the proposed mechanical yard, which will house a standby generator as well as a condensing unit. You can see in the center of the roof plan, there's 2 additional rooftop mechanical units. And then the other driver for the changes is really code and time, right? So the building was built in 1970. So in order to bring it up to code both for lab and also for 2024, we need to do things such as add emergency exits or bring stair railings up to code that aren't currently compliant, things like that. The next page is just a verbal description of that work depicted. The next plan is the level 1 floor plan. So you can see here the building is, as I said, it's 40,000 square feet. Each floor plate is roughly 20,000 square feet. And you see the west side has the plans depicted on the right side. It says NIC not included. This is because at this time, we will only be renovating, or Dynamic Hero will only be renovating the west side of the building to support their needs, with the east side being future expansion space. So the work within that east side would be limited to, whatever's necessary to keep it intact. So the center of the building is primarily vertical circulation. You can see the 2 stairwells. There's an elevator there. There's also bathrooms and then mechanical support rooms, so mechanical, electrical, things like that. And the laboratory space, it's a little hard to see, but up by the stairwell in the north, you see a PPE room. That's where you would enter the lab. You'd need a card to enter the lab and put on PPE. The purplish blue color on the top and bottom is all open lab space. These are benches, things like that. The lighter blue specialty supporting spaces, as well as waste holding. And then the orange in the center is a 1,200 square foot vivarium. Going?
Any questions? Do you want to? No, I'm fine.
Level 2, same story as the first, in that the left-hand side is being fully renovated, the right-hand side is not proposed to be fully renovated at this time. The use on the level 2 is office, so it's very typical open floor plan cubicles as well as office space. And the only thing that is a little bit unusual up here is you see some mechanical rooms in the center at the top and along the center line of the new office space. Those are large mechanical equipment that typically in a lab building you would see on the roof. Whereas, given the vintage of the building and its structural capacity, it made more sense to locate it internally to the building, and so that's what you're seeing there. The next slide is, again, a verbal representation of what I just discussed. So at this time, I would hand the conversation over to Lauren, the lab manager, unless there are specific questions regarding the floor plan and the layouts.
Don't have any.
Okay, great. So as Julia said previously, we've been operating a lab space in Waltham since 2020. So we're familiar with and committed to complying with all federal, state, and local regulations, including but not limited to those that are listed here on this slide. If you go to the next slide. Dynamic Cure is characterized by the Massachusetts Department of Environmental Protection as a very small quantity generator of hazardous waste. This means that we produce fewer than 27 gallons of hazardous waste on site on a monthly basis. However, I will say that we often fall far below that 27-gallon threshold. Our hazardous waste consists of mainly mixed aqueous solvent waste that's made up of methanol, ethanol, and other organic solvents. We contract with Viola Environmental to transport our waste from Dynamic Cure upon request. We also contract with Stericycle for the management of our regulated medical and biological waste. We currently have them doing weekly pickups at our site in Waltham. Our biological waste is collected by Dynamic Cure personnel, and it's boxed for transport as manifested waste for off-site treatment and disposal. Medical sharps are disposed of directly into puncture-proof containers that are then removed again by Stericycle for sterilization and disposal. Moving on to the next slide. Our vivarium is managed by Stephen Della Rocca. He has over 20 years of experience in the field, and he's also joining BioWebEx today. In our Waltham location, we have rodent studies only. Specifically, we work with mice. We have an institutional animal care and use committee, also commonly known as IACUC, that's required to meet twice per year. All study protocols must be approved by IACUC, which also includes our veterinarian, Dr. Estevez. Our studies are oncological in nature, so we perform tumor implantation and treatment. We do not work with infectious agents, and we do not use any recombinant DNA material in the mice. Our veterinarian performs facility inspections and animal health checks. Our mouse cages are changed inside the biosafety cabinet and then disposed of as biohazardous waste. Please note that we use disposable mouse cages. That's why we're able to dispose of them, and as opposed to reusable ones that you wash. Our sacrificed mice are stored in a labeled freezer, and they are disposed of as biohazardous waste in those weekly pickups by Stericycle. And this concludes our presentation. So we wanted to thank you for taking the time to meet with us today, and we look forward to working with you.
We had a subcommittee, and would the subcommittee like to make a report?
I think basically everything that you've just heard is what we heard, and we went through some of the conditions and the concerns. So I think at this point we should just open it up to meetings, because I don't think there's anything new that we can add. Gail, would you agree?
I totally agree.
Thank you.
I feel the meeting was satisfactory.
Excellent, excellent, excellent. Does anyone want to make any
Are
comment?
there any questions?
What I'm hearing is you're moving your operations, so there's no change. You're operating in a space and you're moving your business, your operation. Sounds like your lease is coming up and you're looking for a larger space, so there's no change to your daily operations. Right, yeah, I'm comfortable with what thank you so much. Very clear. And what,
Dr.
Christine?
Ren?
Yeah, I just had a question about the exact material that you're injecting. So is this cellular material, this is tumor cellular material that's being,
So yes, so there are cancer cells that are used for implantation, as well as our drugs that we're researching for cancer treatment.
okay. And so there, I guess I'm just curious and for my own information. So nothing can be spread and there's no way, I mean, what are the types of, are they just injections that are given to the mice in terms of the treatment, the therapies, or?
Well, I can't get into specifics about the therapies because it is proprietary.
Could you please speak up?
Oh, sorry, I can't go into specifics about the treatments. Obviously, they're proprietary. I don't know if either Ming or someone else on the line would like to give a general
Just a general,
overview.
yeah.
And I just follow up, if you're going to ask somebody, the question that I'm going to ask, I'm sure will be asked by the community. Are these transgenic mice?
Let me characterize this way. The animal model used in this field of science, they are not the wild animal. There has been some genetic changes, but it's done by I would say, the commercial available sources. So we purchase this mouse. We do not do any transgenic thing in our facility.
So if I could just build on her so you get the answer is, if any of these mice got loose, and I think that's the question that's going to be asked me, is there any risk to the community?
From my point of view, I think it's of minimal. These are specific lab animals. They cannot survive in the wild. But I believe that if you have more specific questions, Stephen probably can answer it. I don't. It's not. Does not have anything that can be infectious.
There's nothing infectious, but is there anything oncogenic?
The animal itself is not oncogenic.
That's the question I have. Okay, thank you.
Mr. Chairman, I don't know, she mentioned someone following up with that, with Dr. El-Sabahi's question, so I don't know
Yes.
who on the line wants to do that, but if they want to speak up now, just let us know. So we have Steve, Jingping Lee,
Jen?
Jin, you want to follow up? Can you hear us? Oh, there's someone now. We can't hear you. I think you're on mute.
I have Steve's cell phone number. John didn't provide his.
So Steve has said he's in and out, depending on who's speaking. I don't know if they heard the question.
I was just curious to know, is any, I think it was, we kind of asked similar questions in a sense, we're just kind of wondering if there's anything transmissible at all in terms of shedding of any, of this therapeutic agent that's been given into the environment if they get loose, or, like you had suggested, eaten by another animal, could it spread, so it sounds like that's not the case, but that.
Yeah, our therapeutic agent is just an antibody, it's a protein.
Yeah,
It's going to be
okay.
degraded.
Okay, that's kind of what I was.
Steve, did you hear the question? Here he is.
I'm in and out on the questions. Can you guys hear me?
Yes, we can hear you.
All right. So I'm in and out on some of the questions.
And I have the closed captions on, so it kind of comes up. Where did someone say something about shedding or something like that? Or
Just.
I think the question is if,
its own,
do you want to repeat this?
go ahead.
Yeah, Steve, so the question was, is there anything transmissible? Is that correct?
Essentially.
Yeah.
Either from the
If the mouse
therapy,
got it.
if there's any, effect from the therapy they're being given.
In terms of,
To the environment,
like,
if they were to get.
what were the antibodies we're using or the tumor cell lines we're using or anything
Both.
like that?
Is there anything transmissible should, an animal get loose
Sound like it.
yeah.
So there are precautions about that we've taken place many. We do have pest control. There are mouse traps. There are insect traps. There are, from blanking on the word, but all the doors are closed at the bottom, so nothing can get in, nothing can get out.
Each room has its own private door and a sub room to go into it. So if a mouse did get out, it would have to get through the traps, through the first door, and then through the second door, into the animal facility corridor, through the vestibule, which people change in, and then through that outside door. Never in my 30 years have I seen a mouse get out of an animal facility, because that is something that the vet checks on every month when we have our annual vet checks, and is part of setting up an animal facility. And once an animal does get out, you don't want that, because then you can't have that animal in your study. So you want to make sure that everything is copacetic and that there are no problems arise with that.
The question is anything, if an animal got out, is there anything transmissible?
No.
That's the answer. Thank you.
Thank you. Yep.
Okay. There are 13 conditions. Have you seen those 13 conditions?
Yeah.
And do you have any problems with those 13 conditions?
There's one condition that limits the subject animals to mice, and we would request that it be expanded to rodents, given that there's potential that I guess it's in the later stages of the research that
Some model is like
rats.
on rats, yeah. Or other rodents.
I don't have a problem. Can we just, you would need to word it that way?
You have a problem?
Rodents,
I can.
Rodents.
So that would be number, let me look at,
11.
number 11
Just change the word mice to rodents.
to rodents.
Other than that small change, everything looked great to us.
Ms. Falkingham, you got that change, please? I have no other questions except thank you, because I have worked with animals for many years and I had never heard the word vivarium before. I love it, and I had to look it up, and it was very positive to learn the word. Thank you so much.
Excuse me.
Does anybody have any other comments or anything else?
I was actually going to ask that my next question was going to be, are you going to use any other animals in the future? So just rodent,
Yeah, just rodents. For large animals, we contract out with
Right.
outside facilities. We don't do it in Burlington, for
Right.
sure.
Yeah.
And when were you thinking of coming to here? When will you be ready to come here?
Yeah, if everything goes well, we start building, it's gonna be early 2026.
Early when?
2026.
Okay, thank you. Also, one other quick comment, and that is we have a Board of Health faculty of experts, and we would just like to request, and think about it, you don't have to, that when you come to Burlington, if you would like to join our faculty in case a community organization or the high school or any of the schools have any questions about biotechnology, we could call on you to give a talk to the community.
Yeah, we would be honored to provide the community services.
If there are no other questions, I'd like to ask for a motion to approve the application for special permit, One Rounder Way, Dynamicure Biotechnology LLC, with the 13 conditions.
I'll make a motion to approve.
I have a motion by Ms. Welch. Do I have a second? I have a second
Motion to approve.
I've second by Mara El Sabahi. Any other discussion? All in favor, say aye. Aye. 500. Thank you so much for choosing Burlington. Thank you.
Thank you very much. It's our honor.
Thank you.
Thank you.
If you have any questions, please forward them to the Board of Health. Our environmental engineer, our director, associate director, will be happy to speak with you. Thank you.
Thank you. Great, thank you.
I guess brings a discussion, late hazardous material storage permit application.
We don't have any.
It was resolved.
Yep.
Thank you. Staff reports, environmental engineer.
Just one announcement, household hazardous waste is Saturday, 8:30 to noon for residents at Fox Hill School. And any board members would like to come and have fun, more than welcome.
68 for me.
68,
I think it's 68.
okay?
So,
You've been at this a while.
any questions? Any
To
questions?
the whole report or regarding Saturday?
Either,
Oh, okay.
either.
I was just going to ask you about this 226 Fox Hill Road drainage.
So that was a complaint about a budding property doing some grading, but there's really no evidence to support that, the extent of what grading was done, or, that, I don't have any pictures from what it looked like before as to what it looked like now. Looks like maybe they added some loam to extend the lawn.
Any others? I have two real quick. Leahy Institutional Biosafety and Vericel, is that the routine reviews?
So Leahy was their annual IBC,
Okay,
and Vericel was just a pre-permitting conference call. They're looking to file their biological safety permit application this summer, probably appear before the board for that permit in July or August, and with hopes to have occupancy in late October or November.
and Brixmore, where are we? I think they think that we're all set.
They were at Conservation last week, and they provided an updated site plan that met, that I was told met the flood storage capacity requirement that Conservation was looking for. However, Conservation did not take a vote on it because they got the updated site plan late in the game, so they're hearing it on May 23rd. And they're due to come to us on May 28th.
Our next meeting.
Yep.
We'll have Conservation met with them prior.
Yeah, they're meeting the Thursday before our meeting.
Thank you. Any other questions? If not, I'd like a motion to approve the environmental engineer's report.
So moved.
Motion by Mary Beth Wells, second by Gail Demore. All in favor?
Aye.
Aye. Brings us to the Associate Director of Public Health, Mr. Green.
Yeah, Dr. I just want to reiterate showing at the health fair. It's nice to see all the board members there. We had a bunch of great vendors. Safe Trailer, I was really happy to see. I'm going to show up with that one. Good event all around. Great work by the volunteers and our intern and staff. So the only other thing I wanted to highlight was the training that Tim McCoy assisted on. We did a hybrid ICS 100 and NIMS 700 training where we provided the iPads and some handouts and some instruction while volunteers who were not comfortable taking that online training on their own got to actually come in and kind of work through it with us. That was pretty successful. I think everyone really enjoyed that ability to be able to. Sometimes the online training scares some folks, so this one just made it a little bit easier, a little more approachable.
Would you please extend thanks from the board?
Yeah, we'll do.
Thank you very much. Motion by Dr. Sabahi, second by Mr. Moore. All in favor? Aye. Now we have the Director of Public Health. That includes the health agent, the Triton Advisory Board. Will not cover that anymore. First, I just have one. What was going on for Dr. Pepper, a pilot production line? What was she approving? Are you familiar with that?
Yeah, so it's basically coffee, brewing coffee, but they do need a permit for that, so that's the reason why. They're doing some new research on testing out different things.
Thank you. Any other questions? Okay, then we have the Associate Health Inspector, Samantha Hardy's report. I should have mentioned that the health agent is Marlene Johnson. The Associate Health Inspector is Samantha Hardy. Are there any questions for her? You may have noticed that there are 3 new chicken keeping of animals permits coming
At our next meeting.
at our next
No,
meeting.
I believe so.
Great.
That's a lot.
I know. Nothing else? Now, the third is the Triton Advisory Board, the Tobacco Coordinator, Tahisha Soto. She
Yeah,
put in a
Tahisha,
report.
yeah.
That was very nice.
Yeah, so she's, she works for the coalition, does the retail inspections, compliance inspections for the health community.
Thank you. Please note to her that was very nice. I appreciate it. Okay, and the fourth is you, the Director of Public Health, Susan Luminello. Do you have anything that you'd like to report?
We had another successful vaccination clinic today for children, so just want to thank all the volunteers and staff who helped with that. We vaccinated over 20 children today. This will be our last one. First, we get through some over the summer, and then we'll start again in the fall. And then check on these kids to make sure that we have some. So many all goes around. We did have Taisha Soto helps with interpretation at those, but we also was able to get somebody from DPH to come as an interpreter as well at this clinic. And so that was actually really helpful too. So we had 2 Spanish interpreters at today's clinic.
And who did the vaccinations?
We had Chris Pollock came in, we had Rashad Blades, who is the Triton nurse, and then we had MRC volunteer.
Who was the MRC volunteer? Can we acknowledge them? Do you remember who it was?
Yeah, it was Joyce, Pulsini, Joyce Pulsini.
And would you please note to her we thank her? Please.
So you just said you did one for children. How many do you think, how many children you have asked?
So on the list, about 105 now, and that's 105 children, and then any more vaccination, because we have to see the series twice.
Yep.
Yeah.
And so is the Board of Health partnering with the state of Massachusetts, or are we doing that for our town?
So it's all under the Vaccine for Children program. So they provide the vaccines free to us to administer to children in our town.
But it's up to the staff to follow up with the
Actually, no.
because some have to happen within a couple of months, right, or a
Yeah,
year,
so
like,
we work real closely with the school nurses.
okay.
So the school nurse, I'm in communication with them. We actually have like a spreadsheet going where they're notifying us and telling us, okay, we got a new student, or the student now needs to be updated on it, have additional vaccine. The goal overall is to hopefully, get the students in with the pediatrician so
Yeah.
that they can
That's
get back. The problem is that a lot of these uninsured or underinsured, so they can get Mass Health, but it's limited Mass Health. And limited Mass Health doesn't cover pediatricians, it only covers emergency room visits, so that's the problem.
And if they're transfer out of town, is the Board of Health responsible to another town that they?
No, because there's a statewide system, the
Oh,
MIIS system.
Perfect,
So
okay.
we use actually a software called Color. And when we do a vaccination, it goes from Color directly to MIIS, so that all that information goes up to the state. So if they visit another practitioner or a doctor or wherever they go, they'll be able to look up their vaccine. A lot of these kids are not in MIIS initially, so they come with vaccination records from another country, and we will enter them into MIIS.
And do you utilize just the Reserve Corps or the nurses in the town that you utilize to administer the vaccines?
Well, we use our nurses,
Yeah.
like our.
Yeah, so I meant
Rashad.
just the Reserve Corps, like the Board of
Yes.
Health? Okay. I didn't know if it was.
That's a great question. The school nurses don't vaccinate.
Oh, right. So Barbara Conley, who's the lead school nurse, has helped us when we have it at the school. So we've had them at the Board of Health office and at the individual schools. So Barbara is very willing to come and help us if we need it. We haven't, usually use around, I don't know, 2 or 3 vaccinators maybe for a 3 or 4 hour clinic.
And the board
Just kind of curious.
agreed to accept this responsibility because there was a problem with their former program. So they came to us and they said, yeah, we're going to vaccinate you.
Yeah, and it's important because we want to make sure the kids in our schools are vaccinated.
I'm not questioning, it's not important. I thank you for the metrics.
Yeah, I didn't say
No, I know, thank you.
And I have been in contact with the school committee, and they have been very, very happy. They've shown their gratitude to us in multiple meetings. Have noted the Board of Health has been very helpful to them.
And I believe they still are running the clinic for physicals, although I don't know the whole logistics of that, but I think they're still doing that
I was
on
just
a
gonna
monthly
ask if there's
basis.
any way to get, it's challenging,
Yeah,
regular exams for these children.
and I think they have a partnership maybe with one of the local, like, urgent cares that they use for physicals as well, so.
Any other questions? I have one. I just want to bring your attention that there was a letter of gratitude from Dr. Robert Goldstein and the Public Health Council of the Massachusetts Department of Public Health. It was nice for them to send their annual thank you. Are they remote still?
I believe so.
You mean the Department of Public Health is remote?
The whole state is still remote, isn't
Yeah.
it? Yeah.
Okay.
That's another story. for
Well,
another
that's
day.
bananas.
Excuse me?
Well, that's bananas.
Bananas. Don't get me going.
DEP goes in once a week.
Our vice chair is, our vice chair
delirious.
is the,
All right, Gail, if you're going to have that, I'm going to take my vote back.
did you have a banana Saturday?
No, I didn't.
I did. Anyway, do I have a motion to approve the Director of Public Health report?
In all the other reports,
Which includes all of them.
Yes.
So,
all
yes,
of
so
them.
moved. Yep.
I'll second.
Okay, so we have a motion from Ms. Welch, second by Vice Chair Gail Demore. All in favor?
Aye.
Okay. If there's anything else anyone would like to bring up, if not, I have a motion to adjourn.
Adjourn.
Motion to adjourn.
Dr. Elsa by motion, second by Ms. Demore. All in favor?
Aye.
Good night, everybody.
Good night.
Be well, wash your hands.
Eat your bananas.
What?
And eat the bananas.
Did they go home with lots of bananas?
I don't know what they did with the bananas.